So this discussion is about social cognitive theory. And what you see here is a picture of Albert Bandura, and this is just trying to provide evidence to you that not all of these theories are olden day theories. In fact, Albert Bandura is still actively researching and very involved in public health practice and application of theory at Stanford University. So where did social cognitive theory come from? And as we've discussed just a little bit in class, the two paradigms, one being that behavior is very psychologically driven, and the other being that it's very environmentally driven. So let me first start with the idea that it's very psychologically driven. In fact, many people believe, from early theorists like Freud and others, that emphasized what we call psychodynamic theory, and you may have heard of terms like the id, the ego, and the superego. Well, those would be very, very internal, very psychological in nature. By contrast, then, were the radical behaviorists, or people who, like B.F. Skinner and Thorndike and others, who in the 1940s and 50s and 60s, and really even into the 70s, were very heavily invested in a theoretical paradigm that suggested that behavior is motivated and driven by environmental stimuli and environmental determinants. So these would be things like reinforcement. They would be things like behavioral cues in the environment. And people find that to be very appealing because it's what we call parsimonious. And the word parsimony means that it requires the fewest number of assumptions or explanations. Or you can think of parsimony as being simple. And so those are very simple. You may recall from our discussion about self-efficacy theory the problems in measuring self-efficacy. Well, those are essentially nullified when you use a parsimonious approach of radical behaviorism focusing on the environment, because you can see environmental stimuli, behavioral cues, and so forth. You can manipulate them. You can measure them. And so Albert Bandura came along, and essentially what he did is try to marry these two paradigms, radical behaviorism and the very psychologically based paradigms such as psychodynamic theory. And what he did is he came up with something that we call the triadic model of reciprocal determinism. Triadic meaning that there are three parts, reciprocal meaning that they influence each other, and determinism meaning that it's a cause of behavior. So it looks something like this. And you have overt behavior, or we could just call it behavior. We have the environment, so he's bringing in the early paradigms of radical behaviorism and focusing on the environment as a determinant of behavior. And then things, personal factors. These would be psychological in nature. So let me just briefly talk about these things, environmental influences, and I'll give you some examples of these. These are things like having a park in your neighborhood. These would be things like being reinforced for engaging in good behavior. These would be things like being at a party and having peer pressure to engage in drug use, for example. Personal factors. These are psychological in nature. Beliefs, expectations, perceptions, self-efficacy. Those are psychological in nature. They're internal. They're very difficult to measure. But we know that they're important determinants of behavior. Therefore, Bandura has chosen to include those in social cognitive theory. And he's created this triadic model of reciprocal determinism. Reciprocal, again, meaning that they influence each other. So how could environment influence person? And how could person influence environment? And how could each influence behavior and be influenced by behavior? So here's an example of the individual level influences that I'm referring to.
As we enter into the new year, we continue to get bigger, but not any better. The U.S. Department of Health and Human Services set health goals for the nation to reach by 2010. And according to the numbers, there are now more obese Americans than a decade ago. We eat more salt and fat, and more of us have high blood pressure. Daniel Goodwin is a cardiologist at Glendale Memorial Hospital, and he's seen it all.
We encounter problems with obesity and tobacco use on a regular basis. And they get a lecture from me nearly every time on the importance of increased activity, daily episodes of aerobic exercise, and improved diet.
Every 10 years, the government's Healthy People Project reassesses the health goals and reports progress made in the previous decade.
Okay, so the reason why I wanted you to see that is it is characteristic of our current approaches, focusing on the individual. And you notice there the doctor that was being interviewed said, every time I see this, they get a lecture from me. So what does lecture imply? Well, lecture implies that I believe that if I give you information, I can influence your attitudes and your beliefs and your perceptions and self-efficacy and so on and so forth. Well, one can argue the effectiveness of that as we see that the rates of obesity continue to increase, and yet we continue to lecture and do those sorts of things. Nevertheless, it represents the individual level intervention that focuses on the psychological determinants of behavior. Okay, here's environment.
Anna Cabral and her family are working on menu changes at the family business, Olivia's Mexican restaurant, switching to healthier recipes for the new year.
It's something we knew that we had to do with everyone being concerned about their health and more concerned about the way food was prepared. We knew that we needed to make the switch.
On Friday, a new California law will cause Cabral and other restaurant owners to cook their food using oil shortenings and margarines that have less than 0.5 grams of trans fat per serving. Health experts say a diet high in trans fat increases the risk of heart disease. Olivia's worked with its supplier, Sysco Food Service, to try several different brands before they found an oil that worked.
So we can't switch a product unless we have the same taste. Everything has to taste the same. So to get rid of one product, we have to have something that's just as great or better.
Longtime customer Lori Vaughn agrees.
Still tastes the same.
Okay, so let me just break down that example. So here you have a business making a change, and the change is likely to result in health impacts and in this case benefits. People are probably going to the extent that they're eating at that restaurant and eating out a lot, which they are, they're probably going to be consuming less trans fat. Now, we didn't lecture any of the individuals who would be eating lunch. We didn't go to the restaurant patrons and say, hey, you should be eating less trans fat. In fact, we didn't do anything focused on the individual. It was an environmental manipulation. We changed the environment, in this case through legislation. And it will result in behavior change at the individual level, but it had nothing to do with us lecturing them. So you can see the difference between what Bandura would conceptualize as environment versus those approaches that would be tailored and characterized by the individual. Okay, so social cognitive theory. Let's just break down the name. And it previously was called social learning theory. And social learning theory implied that it was heavily invested in learning theory models, which were based in radical behaviorism. And in fact, Albert Bandura himself was more of a radical behaviorist early on. He read and conducted research and was very involved in models and theories that focused on reinforcement. So his first attempt at creating a theory was called social learning theory. And as it became more cognitive in nature, he added self-efficacy. And as he made those changes, the name changed to social cognitive theory. So again, social cognitive theory is this interaction between the triadic model of reciprocal determinism, the environment, personal factors, and behavior. The word social is included because it involves social interactions, social origins of thought and action. Cognitive, because there's a heavy emphasis on cognitive processes, Self-efficacy is the premier construct in social cognitive theory. And theory because, indeed, this is one of the most tested and most widely used theories in public health.